Hey, folks, we're here today, LinkedIn Live, talking about Origami Surgical, tying the Origami Surgical product to the VA and driving positive, fantastic outcomes for our veterans. I got two phenomenal speakers here. I'm going to introduce John first, the CEO of Origami Surgical. John, can you introduce yourself for the folks?
Sure, David. John Hieronymus, CEO of Origami Surgical. Glad to be here. Thanks for having me.
Thank you. We're so looking forward to hearing about your product, an amazing product. And from all the stuff I've heard, I'm so glad your product exists. Okay, Mr. Rob, Executive Vice President, SDV, introduce yourself, sir, please.
My name is Rob Rohde. Been with SDV Medical a little over 2 years, and looking forward to the conversation we're about to have with John Hieronymus and the Origami capabilities and what it can do for our patients.
Excellent. Thank you, Rob. Thank you for being here. You touch a lot of hospitals day in and day out with you and your team. You see a lot of stuff that goes on in the VA. You're going to add a lot of cool value to this conversation, but certainly the star of the show, John, here. So tell us, what does Origami Surgical do?
Well, I'm not the star of the show. Our product and
there you go.
That's the star of the show. But
and I think you have the product there, don't you? At some point, you're going to show it to us.
I do. I'll unveil it here in just a little bit. But cool. So what do we do at Origami Surgical? What we do is we improve workflow and we reduce operative time, during complex robotic procedures. And the way we do this is we enable surgeons to have more autonomy during these procedures, which ultimately does reduce OR time and creates better workflow and a better experience and outcomes for the patient. So that's really our mission. And the way we do that is providing a solution for some challenges that really occur with exposed needle transfer during robotic procedures.
And we're going to hear a lot about exposed needle transfer here in the rest of the session, right?
Yep, we'll get into more detail.
Excellent. Good. It's a very interesting part of all this. It's pretty wild when you start hearing more about it. So, Rob, why are we here? Rob, why is SDV Medical here? What's our purpose?
So, thanks, Dave, for that question. SDV, a little bit of context and history. SDV Medical was founded in 2016 by a father-son and a Gold Star father whose son was lost in Iraq on October 25th of 2006 during Iraqi freedom, and that's Tommy Gilbert. And from the SDV perspective, a lot of us still are veterans who still utilize the VA services and still want to help out our fellow vets. And I think for most of us here at SDV, we look at this service we're doing through SDV as our way to continue serving, even though we are currently out of uniform. As a service-stable, veteran-owned small business, we love bringing new technology and capabilities to our brothers and sisters who are probably going through some tough times, but we want to ensure a great patient outcome, and that's why SDV is here. It's for the mission. Yeah. So thank you, David, for putting this together. Thank you, John, for joining us.
The innovative product is the key with regard to folks like Origami Surgical. So that's cool about it. Now, so here we go. That's us. But how do we help Origami? How do we help Origami Surgical, Rob?
So do numerous things. We can help point them in the general direction of the right audience. But more importantly is we are the acquisition portion of this simplified. We speak the language, if you will. In military parlance for the DoD folks out there, we're a force multiplier. Origami can focus on what it does best, and that's being with the patients and the doctors and the clinical staff. We focus on the back end, the paperwork, the contract vehicles, and the process. That's what we bring the expertise. We got staff with over 200 years of experience across SDV, across the different contract vehicles. And we allow Origami and these other vendors to focus on what they do best. And the process and the minutia we take care of as SDV.
And get the product in their hands as fast as possible.
Yes, sir. That's correct.
All right. So, John, why us? So what was the critical reasons Origami Surgical picked us for this phenomenal product?
Yeah. So I knew some of the folks involved with SDV from a prior organization. So, John and Vanessa and Rob, and so great people. And it's a trusted organization. I mean, SDV does an amazing job, and we have trust in them. And I know all the facilities and government hospitals and VAs have trust in them as well. So that's an incredible partner for us. Then when I learned more about their role or your role in the robotic ecosystem and how that plays a huge part of your strategy and future going forward, then the alignment just got that much greater. So we're very excited to work with SDV from, a trust and strategic standpoint. And then on top of that, we're passionate about bringing the best technologies to our veterans and our soldiers. And they've made a sacrifice for us, for their families, for the country. And, at the very least we can do is just bring them the best technology, best level of care as possible. And frankly, the process to do that can be complex, navigating through the government processes and working with the different hospitals. And so SDV I see as a guide that's really kind of works with us to be able to, again, bring our technologies and our solutions to the hospitals and to the surgeons and staff as quickly and as efficiently as possible, so we can really focus on doing what we want to do. So it's a great partnership. Very excited.
We are very happy you picked us. Thank you for that. Very appreciative. And I know the veteran side is heartfelt based on our conversations previously. And we know it's important to you. That's a wonderful thing. And it's a great common denominator between the two organizations. But now let's really get into why we're here. People are listening to this because they want to understand your products, your product lines, the outcomes that your product drives, how you make a difference. So let's start there and get deeper and deeper as we go through the questions.
Yeah. So I'll jump in. And so
yeah, it's all yours, John. It's John.
All right, I'll take the floor for a second. But so I mean, robotic surgery has really taken off over the last 20 years, and it's really advanced the standard of care for minimally invasive surgery. And so there are more procedures, able to be performed minimally invasively with more consistent outcomes robotically than ever before. But with that, it has introduced, there's a risk of exposed needle transfer that is required, historically in these suture intensive type procedures. And with that, there are, again, risks and challenges that go with it. And Stitch Kit, our product, can address those. I mean, and just give you an idea of some of the things that can happen, while these exposed needles are being managed. I mean, they can be dropped, they can be launched inside the patient. The needles can be bent, they can be dulled, they can get stuck in the trocar, and there's all sorts of things that can happen along the way. That our company was actually founded by an early adopter of robotic surgery, and he essentially became really good at finding dropped and lost needles to the point where he said there's got to be a better solution, and that's when he developed Stitch Kit. So it's a great solution for a very real problem in a rapidly growing space in terms of robotic surgery.
And just a focused solution. So, we had a lot of conversation before this around the exposed needle transfer, and you got a lot of cool information on what happened previously in some of these environments before Stitch Kit was available. So, kind of give us a sense of how does this exposed needle transfer in and out of surgery happen previously with regard before, then how does Origami really help?
Yeah, I mean, there's a few different ways that it's being done today before somebody learns about Stitch Kit. When we talk to surgeons, the vast majority of them look at it and say, great idea, can't believe I didn't think of this myself. How do I get it in my hands? And the reason for that is because there's different ways to do it today, but there's a constant trade-off between speed, efficiency, and safety, and everybody has different perspective on those. So what's most commonly done in terms of needle, exposed needle delivery and removals, it's one at a time. So this typical suture intensive case, they might use anywhere from 4 to 8 sutures. And with the way that works and what that looks like is the surgeon, again, because this is a robotic case, they're sitting 5-10 feet away from the patient. They're not scrubbed in. And then so when they're ready for a suture, they ask the assistant, they'll say, okay, I need a 3.0 Vicryl or 3.0 Polysorb on an SH needle. And so at that point, the assistant, in some cases, is going to have to undock the robotic arm. In some cases, they're going to go through the assistant port, which is a port used for delivery of needles and sutures, as well as suction, irrigation, some other things. And they introduce it, hand it off to the surgeon. The surgeon does their suturing. When they say, okay, I need another one, now then the assistant comes back in, grabs that one, pulls that out, comes in with the next one. Now, during that process, what can happen is, one, the flow of the procedure has been disrupted, because now the surgeon has to, when they need their second or third or fourth needle, they have to move the camera. They move away from where their working space. They then hand it off. They grab the next one. They wait and say, is the needle out? Do you have the needle? Great. Okay, pause. Then they go back and then they continue to work. So there's a little bit of a disruption of flow. And then there's also the risk of potentially as that needle's being removed because
this is scary. This is scary. This freaked me out a little bit. Tell them about this one.
Well, just throw some numbers at you. So 91% of surgeons have experienced a dropped or lost needle anywhere from 1 to 5 times in the last year. And 80% of the time when that happens, it's during the removal of the needle through the trocar. And so that can be essentially the most challenging part of this whole process. And so one at a time, you're looking at 20 to 30, 35 movements that occur during that step or that process. Some surgeons say, you know what, I want to be a little bit more efficient. I want to move a little bit faster. And so then what they will do, which is a different technique, is they will drop in 3 to 5 to 6 needles all at once at the beginning of the case.
This is the pincushion model you talked to us about, right?
Yeah. So essentially they're using the patient as a pincushion. So they'll drop them in and then they will pin them up inside the patient's abdomen. So into most commonly the peritoneum. And then when they need a suture needle, they pull one down, they do their work, they pin it back up, pull the next one down. The challenge that goes with that is one, these needles typically are not in the field of view as they're working, whether they're performing a hernia case or something else like that. So if that needle were to fall, it would be quite a challenge, especially if there's not a suture tail.
They're searching.
They're searching, and
they have to account for that, right? They have to account for that.
They have to account for it. So the nursing staff, every hospital does an amazing job of they count the needles before they're introduced into the patient and into the sterile field, and they count them when they come out. But during that case, for one to potentially get dislodged, that can happen, and it has happened because we hear the stories. And so the risk there is
91% of the time somebody loses something at some point.
Yeah,
right?
And like we said, 80% of the time is when they're being removed through the trocar. And so in this process, you still have to get them out. So you're still removing them. Some cases the surgeon will do 2 or 3 at a time. Maybe it's 1 at a time, but it can still be a challenge as well. And again, surgeons talk to us all the time about this and the ability to eliminate that. Now, the beauty of Stitch Kit is at the end of the day.
Right? Can you show it to us?
Yeah, I've got one right here. So great little device. And so what you can see there is all the needles are preloaded in this case. The sutures are wound underneath that blue plate. And there's also a sharps container. So those are actually spent needles that are dropped in once the suture has been used up. And so what this device allows us to do is we're able to introduce multiple sutures and needles all at once in one movement. As during the case, the spent needles are dropped into the sharps container side. And then when they're done with the procedure, they remove them all at once. That's where one of our surgeons who started using this product about a year ago has done over 250 cases with it, says, you know what I love about your product is it's me and the patient. And Stitch Kit just eliminates a lot of the distractions, the disruptions in flow, and I'm able just to perform the procedure.
So more focus. That's just about more focus. You're not chasing after needles and haystacks, no pun intended.
It simplifies the accountability.
Yeah, reduces count. I mean, there's so much stuff this does. Not to mention, as you talked about with us previously, was the reduction in time spent healing and the risk of infection. But the whole focus area, John, is just amazing when the doctor said that. Okay, I want my doctor focused on my situation, not trying to find the needle in the haystack. I like that. It makes me laugh, so I say that.
No pun intended, right, David?
Yeah, no pun intended. So John, now you tie into robotics, right? And we know the Da Vinci world is hot right now, right? The Intuitive Surgical's product. So tell us how your product fits in with the Intuitive Surgical products, the Da Vinci product and such, and how it fits into the rest of robotic surgery.
Yeah. First of all, Intuitive has done an incredible job. They essentially built this entire market. They started well over 20 years ago. Got involved in prostate surgery, got into GYN, general surgery, and really advanced the standard of care really, really incredibly, to the point now where really just about every surgeon that comes out of training today wants to be a robotic surgeon as they start their practice. So, and now you have new entrants that are also coming in, so the market continues to grow. And so we work very well with Intuitive. They're a pleasure to work with. Again, they've done some amazing things. And our goal is really just to add that greater efficiency, improved workflow, and provide greater autonomy to their surgeons during these cases. And again, it's a great partnership and working relationship that we have with Intuitive.
And yeah, I'm assuming you are agnostic, though, right?
We are. So our product can be utilized. We are suture agnostic, and we are robot agnostic. So we like to coin ourselves as we're Switzerland, and our goal is to just really advance the standard of care. I personally I'm 100% convinced that this technology is going to become standard of care in robotic surgery. I've spent about 25 years in the med tech field. I've seen a lot of products that start off brand new, specific niches, and they just grow and they become standard of care. I've seen it with vessel sealing and all sorts of different types of products, robotics even, where it started and where it's gone to. And my passion has always been bringing innovative technologies to help make surgeons more efficient, provide better care, be faster and better, and help the hospital and the nurses along the way in terms of, again, providing a better environment for them, helping save money and make everything more financially viable for everybody involved. So
yeah, it's kind of it's a huge win-win. You don't have to count needles. You can focus on the patient, and I don't have to worry about stuff maybe inside my system, and I can get healed faster, and I don't have to worry about as much issue associated with infection.
I think every patient and every surgeon wants a consistent outcome. If you're going in for a surgery, the less risk you can possibly have, the better. The more a surgeon can look you in the eye and talk to you about what the expected outcome is going to be is that much better. And what our product does is it provides a consistent environment for everybody involved: surgeon, staff, hospital, patient. And at the end of the day, it's better for everybody involved. And that's why we're so passionate about this and excited to after 10,000 patients that we've worked with so far, be able to bring this to our veterans and in the government hospitals as well.
And let's talk about that then, Rob. It's your turn, Rob. You've just been sitting there looking real pretty. It's your time, my brother. So, you're all over the VA. You, John, Vanessa are running around crazy. You're pushing the robotic ecosystem, getting this phenomenal technologies into the VA hospitals. Can you tell us more about what is this robotic ecosystem? How critical is it to the hospitals and taking care of our veterans and Origami Surgical's part in this with StitchKit?
Well, in a nutshell, the robotic ecosystem, the future is here. It's the way that the surgeries are going to go. So for the ecosystem, I mean, it encompasses an interconnected network of technologies, which John has talked about, infrastructure, but more importantly is the people and the patients, right? And those people and patients are all part of the design, development, and utilization of robots in the healthcare system. It's an interconnected network that deals with detection, the actual surgery, and then patient recovery on the downstream. And Origami really fits that niche. And that downstream portion that Origami fits, the robotic surgery is done, is really focused on the patient outcome efficiencies, faster healing, and quicker time out of the hospital and recovery periods that Origami really brings to the table, that the VA and DoD now are very, very interested in. And we're excited to bring this technology. Again, as I mentioned earlier in the conversation, we're mostly veterans who still utilize the VA system. Yeah. And we still look at this as part of our service, even though we're out of uniform going forward. And these unique technologies are helping our brothers and sisters get in, get fixed, and get healed.
Man, amen to that. Amen to that. Well, gentlemen, first off, phenomenal conversation about a critically important product and a nice little package. Show the product again, John. It's so cool. So cool. It's just like, there you go, baby. It's right there. Yeah, to know more about the product, you can go to Origami Surgical's website. You can go to SDV Medical website. Two very easy websites to get to. We're streaming live through Dan Wisna, our CEO's LinkedIn. You can send him a little message asking him for more information. You can look up John, send a message to John through his LinkedIn, or Rob. Anyways, we appreciate your time. You'll see lots of clips on this going forward, showcasing this product in different lights. Thank you for joining us. Gentlemen, have a good day.
Thank you, David. Thank you, John.
Thanks, Rob. Thanks, Dave.